Hello, and let's talk about the upcoming shutdown in India. Over the weekend, many parts of the country have moved towards a new phase in dealing with the coronavirus pandemic. We had the Prime Minister's speech and the Janata curfew on Sunday. Immediately after, 75 districts or 80 districts were identified for a shutdown, with various state governments announcing a raft of restrictive measures. We'll discuss this more, but here are some details about the situation right now. The number of cases in India is reportedly 424, of which 393 are active. The death toll reached 7 yesterday. The total number of cases worldwide is close to 340,000 with 14,717 deaths. The number of recovered cases stands at close to 100,000 according to the Johns Hopkins tracker. A mini shutdown was witnessed in the country yesterday as part of the Janata curfew. However, at least in some parts of the country, the call to celebrate the efforts of health workers and those in the front lines may have backfired, with people carrying out processions and generally ignoring all norms of social distancing. 80 districts in 22 states and 5 union territories were identified by the government for lockdown. In Delhi, the government announced the imposition of Section 144 until March 31st. Similarly, West Bengal has announced a lockdown till March 27th. All rail and metro services have been suspended till March 31st, although goods trains will continue to run. Domestic operations in Delhi airport will continue, although the arrival of international flights has been barred. We discussed this issue with Prabir Purkayastha of NewsClick. Here is what he had to say. Thank you so much, Prabir, for joining us. So we've seen that over the last few days, and especially yesterday, there's been a considerable spike in cases. And if we look at the numbers over the past few weeks, then if we take the number of 50, the time in which each day the number of cases increase, it shows quite a strong progression. So how do you estimate what is happening right now regarding the spread of the disease?
See, as we said right from the beginning, that this is not going to be a if India gets the epidemic, but a question of when. What happens after that, of course, depends on what we do.
Right.
So if we look at the progression of the cases, it's clear that you're moving from containment, that means people who are coming in from outside, who are infecting maybe the people they met. So you could trace the contacts, you could contain it, you could quarantine them, separate them. All of that would work if you could do contact tracing and really test extensively. Now, we didn't have that many number of tests, so we tested really those with symptoms. So otherwise, we isolated them. We asked them to be under self-isolation. As you know, a large number of them did not observe the rules of self-isolation. They went and even partied. So given that, it now appears that we're getting cases where there's no past history of contact.
Right.
So this would seem to indicate we have moved, at least in certain areas, into what would be called a community stage, in which we do not know who's infecting whom. This is the progression that we are in at the moment. It does appear that in certain areas we have crossed the tipping point. Now, the problem that we have had is that when Mr. Modi announced that we'll have a Janata curfew, people took it that there was a lockdown coming. And they then didn't want to be in the cities where they don't have any employment, they're not going to get the daily wages. And since there is no provision made to address these issues, a lot of them immediately left for home. So we had huge crowds in the railway stations, and then people, if there were carriers, spreading it to all over the country. So it in fact did the reverse of what it was expected to do. Instead of isolating, it created, in fact, a huge surge of flows across the country. So I think that is something that we should have prepared for.
Right.
The second part that we have is the testing was still very sparse. Now, ICMR has said they're increasing the testing. They have, instead of 52 laboratories that they had originally, now they're 111. But even then, we're really talking of something like 100 tests per laboratory. Maybe some have more capacity. So we're really looking at 10,000 samples to test, which is probably 5,000 to 6,000 people. You need 2 samples. So given all of this, that we are really testing 5,000 per day, which given the size of our population, would making us one of the lowest testing figures per million in the world. So we're really not doing well on that count. So without extensive testing in the community phase, you cannot really contain the epidemic, because what Chinese have shown that even in a much more efficient lockdown than we could imagine in Wuhan, their reproduction rates were higher than one. That means though the numbers were not going up as fast, they were still going up. In fact, this is very close to what's happening in Italy, that the numbers have not shot up astronomically in terms of new infections per day, but they're still increasing slowly. So this is where you need really extensive community testing. If we look at what the Chinese did in Wuhan, they didn't just do a lockdown and cordon sanitaire around Wuhan as it is thought. They did something more. They did three things which are important. One is the segregated people who were having mild infection or some infection, initial stages, into gymnasiums, community centers, into exhibition centers, and also into stadiums. These were makeshift places. They'd also built, as you know, some hospitals, makeshift hospitals. They moved them over there, and that was how they took out the infected people from the general population. They took them out of their houses, because if they remain in their houses, as we are now saying, you infect the other family members, and that also is a slow spread. You slow it down, but you still spread. The second thing that they did was the health workers. The health workers did not stay with their families. They were put up in hotels, in other facilities, so that they were also protected. Third was giving them adequate protection, protective gear. So this also meant that the doctors, a large number of them fell ill. Doctors, nurses, other support staff fell ill in the first phase. In the second phase, none of them fell ill. So they could maintain that. As you know, we are already having a huge crisis of equipment, both for the seriously ill, ventilators, etc. We don't have that many. We still haven't reached that phase. But if we do, we are going to get a collapse of those ICU numbers, ICU facilities and ventilators. So all of that is there. But at least they also protected the hospital staff. And as we know already, we are finding huge problems with giving enough equipment for our protective gear for our hospital staff. So I think these are the things that we have to still learn quite a bit from what the Chinese did. People have taken the wrong lessons, just the lockdown. The lockdown is not good enough. We need to do something more. And that more is something we have to prepare for.
So one example, of course, of the fact is that while the curfew was maintained yesterday, when the time to thank the health providers came, in some places at least, it became a full-fledged procession, which really means that the message has not gone down properly yet.
Yes, I think the whole issue of making it into a kind of celebration, which is what the message seemed to have been, that you crowd into your balconies, that's still okay. There is a separation. But when you come and make it into a procession, that means a major opportunity for the Prime Minister to tell the people what to do got lost in the way they were supposed to thank the people. So the messaging, the scientific content of the messaging, distance, lockdown, all of this became instead that we celebrate in the evening, and quite a number of places made it also into a religious expression. It was more like what used to have, Shitla Ma Ka Daya, the goddess will bless us. So you pray to the goddess. So there were all these WhatsApp groups saying that we should thank not only for the people, but to also pray to the gods and goddesses so that we don't get infected. So this whole thing of a huge public education exercise was missed. And the second thing that was missed, what happens to the people who are daily wages? What happens to the basic infrastructure? What happens to the tests? What happens to providing support, financial support for those who are going to need it? None of these were addressed in the Prime Minister's speech. So it was as if we, by blowing conches and clapping our hands, will keep the virus at bay. Right. So this is a completely, as I said, a completely wrong messaging. First, by the huge number of people who immediately started going home, And the second is the fact that you did not really say what this was about, but you asked people to clap and celebrate for 10 minutes. And that became as if it is another fight against the Pakistanis, the terrorists, and as Mark says, Donald Trump says, the Chinese virus. So you externalize the enemy instead of internalizing the battle you have. And I think that's something that we're going to again pay heavy price, because the Prime Minister really missed a major opportunity for public education and giving us the message that it needed to be given, which is listen to our scientific advice, listen to what doctors and other experts are saying. And this praying to the gods and goddesses, which is what the message that the people seem to have taken, is not going to be very helpful.
Thank you so much, Prabir, for talking to us. Our next story is about the emerging political situation in Madhya Pradesh. We have Pranjal to talk about this. Pranjal, thank you so much for joining us. So we hear that the BJP is likely to stake claim to form the government on Tuesday, and amid all this coronavirus controversy, the major issue as far as Indian democracy has been ignored, okay, it's kind of been sidelined. So Kamal Nath was left with no other option, and we see that the BJP seems to have finally won.
Yeah, so you need to understand why this hurry is there in ensuring that the government is formed. So obviously, once Kamal Nath has resigned, the government needs to be formed. But 26th is also a date when the Rajya Sabha seats go for polls in Madhya Pradesh. So it's important that the government is in place before this happens, so that BJP, which was earlier not in position to win the seat, can win now.
Right.
And now Scindia being there, and 22 MLAs who have already resigned from the Congress and have switched over to BJP, their fate also hangs in. There's a lot of uncertainty over it. So if the government is not formed soon, and some of them, I'm sure, will get some of the ministerial berths,
right,
as we can see in the news reports, that at least 8 of them will be promised some kind of the ministership or other. So that's why all these things need to be done. Now, the question is, the mandate was not clear for anybody in Madhya Pradesh.
right.
BJP had 107 seats, Congress had 114 seats. The margin was very low even in terms of vote share. But as Kamal Nath said, the mandate was basically in favor of the Congress government. Once these 22 seats go for polls, what is going to happen is still
Right.
an uncertain point. Suppose if Congress ends up winning all those 22 seats, will we see again Congress forming the government? That is what is going to happen. 4 independents are still there. BSP, SP is still there. What is going to happen to them? There is no certainty over it.
Right.
So there is a lot of uncertainty in the air vis-a-vis Madhya Pradesh political scenario. And then we hear that Narendra Singh Tomar might be the person
Exactly.
who might become the chief minister, and he is the front runner. Shivraj Singh Chauhan was chief minister in Madhya Pradesh for continuously 3 terms. And then we hear that Narendra Singh Tomar is going to be
And
the
he was
chief
also
minister.
in the forefront of the efforts to approach the Supreme Court.
Right.
And
And ensuring that this Kamal Nath government falls.
right.
What is the reason behind it? Speculation can be that Shivraj Singh Chauhan has never been considered as somebody who is close to the top leadership of BJP right now, which is Mr. Narendra Modi and Amit Shah.
Right.
But those are all speculations.
So also the fact that he's from the Gwalior region, I believe.
And he's from the Gwalior region, and since
Tomar,
obviously
that is,
Tomar, Narendra Singh Tomar, and now with Jyotiraditya Scindia being there in BJP, somebody who's coming from that region, and what hold he has in that region is very clear from the fact that 22 MLAs from Congress have resigned, out of which 6 were ministers.
Right.
So someone within the BJP coming from outside, basically standing up to that stature in that region, you need a counter to it.
Right.
Right. So this could also be a tactic that since Scindia is now in BJP from that region, you need a taller leader to counter his prominence inside the BJP,
Right.
and so that he doesn't once overtake that entire
Exactly.
organization. That's why Narendra Singh Tomar could be one of the
Right.
leads for that. Yeah.
Thank you so much, Pranjal. That's all we have time for today. We'll be back tomorrow at 3 p.m. with the major news developments of the day. Until then, keep watching NewsClick.